Hello everyone, how are you? Welcome to another question and answer session. A homeless 42 years old male had an emergency inguinal hernia repair 24 hours previously. His BMI is very less, which is 15, which is the below standard level. His electrolyte is normal. What is the best initial feeding regimen? That means BMI, less BMI patient, 24 hours previously undergone an operation, which is the inguinal hernia repair. So what feeding should we give? Here the option as the 10 kilocalorie per day initially, 35 kilocalorie per day with supplement of the vitamins, no changes in the diet, oral thiamine and B complex, give 35 kilocalorie per day initially. So what is the event? First of all, let's see the nutrition refeeding syndrome, which is an important term. What is this? The refeeding syndrome is a metabolic abnormality. The refeeding syndrome is a metabolic abnormality. When it occurs in a patient who has a period of the starvation. So when a patient long time starvation, so for initiating food of this patient or person, we should be very cautious because their metabolic abnormalities develop. And what are the metabolic abnormalities? Which is the hypophosphatemia, that means the phosphate decrease, hypokalemia, potassium decrease, hypomagnesemia, that means magnesium decrease, and abnormal fluid balance. And these abnormalities can lead to organ failure. So to prevent organ failure, we should be very careful to give food of a starved person long time. So the refeeding syndrome, if the patient not eaten 5 or more than 5 days, and 5 or more than 5 days, and refeed should start less than 5% of the energy level or protein level. So what we need, we should give 50% only of a person who is on refeeding syndrome. And who are the high risk for refeeding syndrome? Here, if one or more of the following present, that means one of the following symptom or one of the following finding is enough for refeeding syndrome, such as BMI less than 16. Here in this patient BMI is 15, so he is on the refeeding state. Then unintentional weight loss more than 15% over 3 to 6 months, little nutritional intake more than 10 days, hypokalemia, hypophosphatemia, hypomagnesemia, period to feeding. And what also, if 2 or more findings present, then it also develop a refeeding syndrome. BMI less than 18, unintentional weight loss more than 10% over 3 to 6 months, little nutritional intake greater than 5 days, history of alcohol abuse, drug therapy like insulin, chemotherapy, diuretics, and also the antacid. So the patient who are taking this type of drug or alcohol, he or she may also develop the refeeding syndrome. So what is the prescription or the treatment should start for this? First of all, we should start at the 10 kilocalorie per day. Normally a person requires 20 to 30 kilocalorie per day, but we have to start at least less than 50%. So 10 kilocalorie per day, and we have to give supplement of thiamine, also the vitamin B complex. Also we should give potassium, phosphate and magnesium, because all these parameters are less in the blood. So what we start 10 kilocalorie per kg per day, and also give multivitamin supplements such as the thiamine and other vitamin B complex, and also if possible potassium, magnesium and phosphate also.